So back pain is one of the most common problems that we see. About 80 to 90% of people will experience back pain at some point in their life. However, what is often not recognized are the barriers to recovery. So some of these are things like anxiety and depression, obesity and nutritional problems, sleep dysfunction, fatigue, lots of different contributors that can actually prevent the patient from going through their recovery. Things like pain that prevent them from being as active as they would like, or fear about mobility can be things that often will prevent them from recovering as timely as they should. The medical home model is really one that's been used previously in primary care. We're adapting this to subspecialty care, in this case musculoskeletal medicine, where patients can feel like they have a place to come where all of their needs can be taken care of. Again, in this situation, we're using this for musculoskeletal medicine, where we're addressing all of the barriers that contribute to their problems and prevent them from recovering. So the musculoskeletal medical home, the goal of this is to be patient-centric. We want the patient to set their own goals. We want the patient to be involved in the goal setting from the very beginning. We'll ask the patient what they're having problems with, what are their barriers, what are the things that they can't accomplish because of their pain. We'll focus this initially on low back pain, as that's going to be the initial push with the first phase of the musculoskeletal medical home, but we'll also start to include other types of musculoskeletal problems like osteoarthritis, etc. as we move downstream. We'll collect typical patient-reported outcomes like an Oswestry Disability Index, pain scores, these sorts of outcome measures that are going to be very important with patient reporting to some of our insurance companies. But in addition, we'll be very focused on what is important to the patient and following their own specific goals through the course of the program, where we'll be decreasing unnecessary utilization, things like unnecessary imaging, overuse of prescription medications that may not be appropriate for the patient, decreased use of things like emergency room visits and urgent care visits that have been shown to not have a beneficial effect on outcomes for patients with low back pain. And what we're hoping to do is, by bringing all of the barriers to their recovery under one roof and addressing these in a comprehensive way, we hope to improve outcomes, albeit decreasing utilization and improving costs. So it really is an opportunity to have a win-win for our system.